Welcome to the Borno Health Update. I'm your host, Ibrahim Amarawa. On our program, we track the advancement in the healthcare under Governor Zulum's administration. In this program, we focus on the transformative efforts spearheaded by Professor Baba Malamgana, Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare systems. In a major push to strengthen Borno's health sector, Governor Babagana Umara Zulum's administration has revitalized over 120 primary healthcare centers across the state, including the Dharmari Comprehensive Primary Healthcare Center in Kondiga local government area. These upgraded facilities are now equipped to deliver quality and accessible healthcare services to local communities. During the commissioning of the newly Dharmari Center, the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, represented by Dr. Mui Aina, ED of the National Primary Healthcare Development Agency, said the initiative aligns with President Bola Ahmed Tinubu's goal of making basic healthcare affordable and accessible to all Nigerians. Dr. Aina commended Governor Babagana Umar Zulum for his commitment to strengthening the state's primary healthcare systems. Let's hear the minister's comment after the commissioning.
Coordinating Minister for Health and Social Welfare, Professor Muhammad Ali Pate. I have come here together with the SWAP National Coordinator, Dr. Muntaka, and we have commissioned the revitalized Dharmari Primary Health Center in Konduga local government in Borno State. The PHC revitalization agenda is a core part of President Bola Ahmed Tinubu GCFR's Health Sector Renewal Investment Initiative as a mechanism to make basic services more accessible and more available to all of us in Nigeria. And Borno State again has demonstrated real leadership. We have commissioned this PHC, we're going to do a second one, but these are basically indicators. I am aware that His Excellency Governor Babagana Umar Zulum has really revitalized about 123 PHCs, is what I am told, and almost all of them have been completed. Those that have not been completed just have, they are in the final stages of it. And this is, in fact, state of the art in terms of what we define as a fully functional level 2 PHC. It has 4 units of residence quarters. It has 30 inpatient beds. It has solarized power. It has solarized borehole, and the infrastructure is just fantastic. We have just done a tour of the facility. So I commend His Excellency Governor Zulum, as well as his health team, the Honorable Commissioner and the Executive Secretary, for the work and the leadership, and ask that you continue to push and do better. You are doing well. You have done well, because we work all over the country, but there's always more to do for our people, and we're very impressed with what we have seen today. We're very proud to be associated with you, and as a federal government, we will continue to back you up and support you with technical assistance, with resources, as we work together to achieve President Tinubu's health agenda under the Renewed Hope agenda.
Shortly after the commissioning, the Secretary to the State Government, Bukar Tijani, along with the Honorable Commissioner for Health, Professor Obama Langana, and the Executive Secretary, Primary Healthcare Development Board, led the minister's entourage on a tour of the facility. The visit was to showcase how the Dharmari Level 2 Primary Healthcare Center is now fully equipped with all necessary state-of-the-art medical equipment required for a primary healthcare center.
Hello.
Similarly, the entourage proceeded directly to commission the state-of-the-art cold room recently rehabilitated by the Borno state government in collaboration with the UNICEF. In an interview, the secretary to the state government, Bukar Tijani, emphasized that the refurbishment of the state cold room and the revitalization of primary healthcare centers are a key component of Governor Zulum's broader agenda to enhance the well-being of his people.
Under His Excellency Professor Babagana Umar Zulum, the primary health care has taken center stage as his major resolve of his administration to put the health sector, education sector, and other sectors to be in the front burner and running. One of the issues is that Borno has been devastated by the floods in 2024, but then this is in addition to the protracted insecurity. But then His Excellency's administration is poised to build Borno back and better. Where we are today has been rebuilt, has been remodeled so that it can stand the test of time, and also expanded in terms of capacity, in terms of management, to provide vaccines needed for our children. So basically, this is one out of 123 that has been rehabilitated, but there is a lot more that is coming. And I want the audience to mind that the Kashim Ibrahim University Teaching Hospital, which is more or less one of its kind, owned by any state government in Nigeria, is also coming up. So the resolve is so many. The PHC, that's primary health care sector, has been put as a major area of intervention by His Excellency, so that those of our people within the environs, within cities, the state capital, and also our rural areas can have access to primary health.
You know, the last time I was on this property was in September of 2024, right when the flood happened. And what we saw, as we have seen from some of the pictures today, was very devastating. But together, as a collective of partners, the Borno State government under Gov Zulum, the federal government under President Bola Ahmed Tinubu and my coordinating minister, and our partners have come together and we have restored bigger and better and even more resilient. You can see that the vaccines are now stored upstairs. We don't pray that there's another flood, but you know, the space is larger, it's flexible, it's solar powered, so it's more resilient. So very proud of what we have been able to do, and know that this will go significantly towards our collective goal to get it.
Similarly, the coordinating Minister of Health and Social Welfare was at the dual ceremony marking the graduation of Cohort 10 and the reduction of Code 20 of the State National Health Fellow. The coordinating minister, represented by the Executive Director, National Primary Healthcare Development Board, Dr. Muyi Aina, praised Governor Babagana Umara Zulum for his unwavering commitment for placing Borno State at the vanguard of the national health transformation.
I would like to warmly congratulate His Excellency, Governor Professor Babagana Umara Zulum, the Governor of Borno State, on multiple grounds. Borno State is always a first under Professor Zulum. It was just last week, Monday, that His Excellency President Bola Ahmed Tinubu, the President of the Federal Republic of Nigeria, asked that the states, he onboarded the second cohort nationally and asked that the states implement a graduation ceremony and an onboarding for the first and second cohorts respectively. Again, Borno State is the first to do this. Some of us are starting to get used to that now, getting used to Borno State being the first in many things. But for those who are newer to it, welcome to how Borno does their thing. Always the first. So thank you. We don't take that for granted. The history of the National Health Fellowship has been said. I'm not going to repeat it, but it's important to establish that it was launched by Mr. President in February of 2025 to really inject fresh energy and talent and leadership into frontline health service delivery and in support of the Nigeria Health Sector Renewal Investment Initiative. You guys were very competitively selected, as has been said, and you should be proud of yourself. You have also made it through 1 year. This is for the cohort 1, but also a learning for cohort 2. So you should be extremely proud of yourself. Completing 1 year of service as cohort 1 has helped strengthen accountability. As you worked side by side with the performance and financial management officers, you have helped improve frontline coordination and data visibility. You have supported some of our very important programs, immunization, MNCH, and some of the other primary healthcare centered services. And because of you, we know that our citizens are now starting to rebuild trust in the primary healthcare system. And we know this once you look at the service utilization and the facilities. More Nigerians are going to health centers to receive services. So you fellows, you represent the operational backbone of our reform agenda, and you complement other reforms in basic healthcare provision fund reforms, our primary healthcare revitalization reforms, our health insurance reforms, and other policy and service front-facing reforms that the government is leading.
In his remarks, Governor Babagana Umara Zulum, represented by the Secretary to the State Government, Malam Bukar Tijani, expressed gratitude to President Bola Ahmed Tinubu and the Coordinating Minister of Health, Professor Muhammad Ali Fatih, for their steadfast support of Borno State healthcare sector.
The first one goes to the big one, our President Bola Ahmed Tinubu, for championing under his renewed hope agenda on health and others. Today we are on health. I want to appreciate him for giving us the opportunity as Borno State and sub-national for us to graduate Borno State National Health Fellows today, and also onboarding the cohort 2 for the National Health Fellows. I want to appreciate the Coordinating Minister, Professor Muhammad Ali Fatih, Coordinating Minister of Health and Social Welfare of Nigeria, for championing not only primary but also tertiary health. I recall 2 things. During the flood of 10 September, the Coordinating Minister was here. He visited quite a number of places, including the University of Maiduguri Teaching Hospital, where a similar activity has taken place. He has also caused a lot of philanthropies as well as his ministry to rebuild and also to replace equipment that are not only being used in Borno, but the whole of Nigeria and West Africa. I also want to appreciate the ED and CEO of the National Primary Health Development Agency, who is sitting here with us, our brother, a strong partner. In fact, I was most gladdened, representing His Excellency, to see him at the EPID unit. For those of you who are 35 and above, you will know what the EPID unit is. And that's in the middle of town, around Maidokiri, east of the zoo. He came to see that place when the floods happened. And between himself, our major partners, UNICEF, were able to rebuild that place better. And this is also something which goes with the motto of His Excellency, building Borno back and better. We thank you. I also want to thank the SWAP coordinator, national coordinator, Dr. Mantika Umar Sadiq, our MC. You find it difficult to call his name. Mantika is a common name, very common name in some cycles. We thank you for all your efforts. I also want to thank the Commissioner of Health, who is here with his team, with the State Primary Health Care Development Agency, as well as the Chairman of ALGON, as well as the Chairman of JERE, the representative of His Royal Highness, the Permanent Secretary, Minister of Health, who is sitting here, the Health Ministry personnel who have been there for quite some time and looking after quite a number of things. That goes to also say the provosts who are here, of the schools, colleges of nursing, and the board of the HMB, who have been championing quite a lot of things within the state.
Delivering the welcome address, the Commissioner for Health and Human Services, Professor Baba Malamgana, briefed the participants on the transformative effort of Governor Zulum's, noting that over 122 primary healthcare centers across the state have been revitalized under his leadership. He further announced that by the end of this year, Borno is projected to have 50 general hospitals.
It gives me a great pleasure on behalf of Borno State government under the visionary leadership of His Excellency Professor Babagana Umar Zulum, CON MNI, to warmly welcome you to this very significant occasion, the graduation of 27 health fellows of cohort 1 and the onboarding of 27 new health fellows, which is cohort 2. Before proceeding, I would like to seek the indulgence of Your Excellency to briefly acknowledge the transformative leadership of His Excellency Governor Professor Babagana Umar Zulum. Since assuming office, he has demonstrated uncommon commitment to rebuilding Borno's healthcare system from the ground up. His administration has prioritized primary health care in terms of revitalization, which last year alone, His Excellency achieved 123 primary health care revitalization in the state. We've also witnessed expansion of the secondary healthcare facilities, and presently, by the end of this year, we will have 50 general hospitals in Borno State alone. His Excellency has also strengthened the Borno State Contributory Healthcare Scheme, and recently the formal sector has been brought on board. His Excellency has also invested in emergency medical services with the establishment of SEMSAS, which is State Emergency Medical and Ambulance System, with focus on pregnant women 24/7 services on a toll-free number that you can reach at any time during day and night. We've also witnessed the establishment of colleges of nursing in Mongno and colleges of nursing in Goza. Both have been accredited fully by the Nursing Council of Nigeria, and students have already commenced their studies. I wish to advise you that Borno State alone, with the facilities and upgrade of our College of Nursing in Maiduguri, in 1 year or 2 years' time, Borno State alone will be producing 1,000 nurses and midwives per year. And His Excellency has also established the Kashim Ibrahim University Teaching Hospital, which is almost ready for commissioning. So keep watching out this space, and you will soon hear the arrangements for the commissioning of the teaching hospital. These bold reforms, healthcare reforms, reflect a clear understanding that human capital development, especially in health, is central to the state's recovery and long-term prosperity. It is within this reform-minded environment that the National Health Fellows Program finds a strong footing in Borno State. Today's event is more than a ceremony. It is reaffirmation that Borno is deliberately nurturing the next generation of health system leaders, young professionals equipped to strengthen primary healthcare systems in terms of performances, improve data, enhance community engagement, and drive accountability at the front line.
The ceremony's key moments featured the formal presentation of awards to the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Fati, and the SWAP Coordinator, Dr. Muntaka Umar Sadiq, alongside the official delivery of engagement letters to the incoming cohort of health fellows.
This award is awarded to you especially by His Excellency for not only being his friend, but being a major partner in the support that your ministry has been rendering to the people of Borno State in Nigeria. To God be the glory, and thank you so much. And congratulations.
Local government area. Similar.
Thank you for joining us. Stay tuned for next week's update, where we will explore more innovations in the healthcare sector. This is Ibrahim Amarawa reminding you, health is wealth. Borno is on the rise.